Today, we're diving into a topic that affects millions and hits close to home for so many of us, hair loss. But don't worry, we've got the ultimate expert in the house, Dr. Cindy Chambers. She's going to break down the latest and most effective cosmetic treatment, from cutting-edge therapies to insider secrets you won't hear anywhere else. We're going to show you why Zen REGEN is changing the game in hair health. People are literally flying in from all over just to experience what we offer. So trust me, you won't want to miss this episode. Welcome to the Zen REGEN podcast here on YouTube. I'm your host, Megan Sharpe, and I'm so glad you're here. This show is your go-to space for the latest breakthroughs in health, wellness, and aesthetics. From red light therapy to longevity medicine, we cover it all with one goal: to help you feel, look, and live your absolute best. Make sure to hit subscribe and tap the notification bell so you never miss an episode. And if you're ready to dive deeper and work with our team, head to zenregen.com. Now let's get into today's episode. Good morning, Dr. Chambers, and thank you so much for hopping on with us today. I love chatting with you, and as always, you're the one that I go to for all of my information. So I'm very excited to have you on today.
Awesome. Thanks for having me.
Let's go ahead and jump right in. I feel like hair loss is one of those things that there's so much information out there and people don't really know where to start. It's very overwhelming. And so based on your experience, what treatments and everything tend to deliver the best results, especially the ones that we offer here at Zen REGEN? I'd really like for you to talk about some of the cosmetic services or just treatments in general that people hear about, and then what we do at Zen REGEN that sets us apart.
Absolutely. First of all, in hair loss, the very first step that's the most important is to get the diagnosis right? Understand what you're treating so that what you're treating actually ends up working for you. Not all treatments work for all types of hair loss, just like not all things work for every patient. So that's the very first step in any management plan, any well thought out management plan, is making sure you have the diagnosis right. It's important to go to someone who knows how to diagnose alopecia, is very familiar with it, and is comfortable with a variety of treatment options. So in general, I tell people alopecia is just a generic word for hair loss. If you have hair loss, you have alopecia. It's just what type of alopecia do you have? So there are two really broad categories of alopecia. There is the category of scarring alopecia and the category of non-scarring alopecia. And within those categories, there are several different conditions that sort of fall under each of them. And I think we'll talk about those a little bit later. But it's important to kind of look at all of our options that are available and make sure that we are targeting the underlying process. Because if we're not targeting the cellular process that's leading to that type of hair loss, we're not going to get the results that we're hoping for. And in fact, it can be a little bit counterproductive. If you have a scarring alopecia and you're not treating that inflammation, that scarring alopecia will continue and you will continue to lose hair and eventually scar down and not be able to grow hair back. So it's important that we have the right diagnosis early on and that early intervention is utilized so that our long-term results are optimized. So that being said, there are a number of treatment options out there. You know, we have everything from topical therapies, which I think are sort of a must for everyone. If you're having any sort of hair loss, topical therapies, variety of things, over-the-counter Minoxidil, various compounded prescription medications that can be used, even some botanical treatments. I know Givome makes a really great botanical topical hair serum that can be used with pumpkin seed oil and bringarage. But there are a number of topical things that can be used, either botanical or prescription-based, and that's a great first start. Then there are oral things, typically pharmaceutical agents or supplements. Supplements are very helpful for a lot of people. There are a lot of good supplements out there. There are a lot of not good supplements out there. So it's important that you go to someone that knows what they're doing, that maybe had a dermatologist or somebody that's really familiar with the hair cycle, be a part of that formulation process. And then in terms of the pharmaceutical agents, you know, there's various things that we'll talk about a little bit later in the podcast, but basically these agents are employed to thicken the hair, to reduce shedding, to essentially bring more micronutrient vascularity to the hair follicle, sort of reduce some of the hormonal aspects that are leading to hair loss in some cases. And then you have what's called procedural. So that's our sort of our last bucket, the procedural type things. So within that procedural bucket, there are things like laser hair restoration, and we do some of that at Zen REGEN, which is pretty phenomenal. We'll talk about that in a minute. There are injectable things like PRP or platelet-rich plasma that nourishes the follicle and provides growth factors, essentially the things that kind of stimulate the hair follicle to grow a little bit more. There are other things like laser caps, red light therapy. Those things are helpful in some ways. They basically bring a little bit of nutrient value to the follicle and help stimulate just the blood flow and the ability to grow a little bit more. Under all those, we basically tailor a treatment program to the individual patient based on the type of hair loss they have and their needs. And it's not going to look the same for everybody. It's going to be a little bit different, but we do have a number of options. It's really exciting now that we have things that we didn't have even just 3 or 4 years ago. So it makes us very excited to help people with hair loss these days.
Yeah, that's wonderful information. And it is really important to approach it from all aspects. I mean, we definitely talk about that all the time. Can you talk about how effective they are when combined and what kind of outcomes our patients can expect from these advanced treatments?
I think combination therapy is almost always the way to go. There's really no one quick fix for most things in life, unfortunately, despite, what's often pushed online and in various mediums. Oftentimes you have to approach things from multiple angles, right? So the physiology of hair loss is multifactorial, meaning that there are a number of different things leading to it. You might have a hormonal aspect, you might have a vascularity aspect, you might have inflammation contributing. And if we don't address each of those things uniquely, you're not really hitting the whole picture and you're not going to get the result that you're hoping for. So almost always, if a patient is on board, we try to do a couple of different things. So to have a sort of more holistic approach and treat things from multiple angles, you will get much better outcomes doing that. It is slightly difficult to study when you have many things part of a regimen because inherently studies are built to evaluate one thing at a time. But sort of anecdotally and through thousands and thousands of patients, dermatologists across the country, it's well known that if we combine things, you're going to get a synergistic effect in their outcome and in the way they work.
So talking about studies, Dr. Chambers, you had mentioned that they're normally looking at one thing at a time. And I know one of the devices that we utilize at Zen is the Fotona Dynamis. Can you talk a little bit about that laser technology and why you specifically chose to bring that into our clinic versus other modalities?
So the Fotona is a remarkable device. It does a number of things, but one of the very cool protocols or features of the device is for hair restoration. It uses what's called a smooth mode, which is unique to this particular company. Fotona has been around for 60 years now and one of the largest and oldest laser companies in the world, actually. And basically what it does is it smooths out this beam of erbium. So almost every other laser company in the world uses erbium as a fractionally ablative or ablative technology, which is creating holes and essentially little wounds in the skin to stimulate cellular turnover and rejuvenation. In this particular mode, it smooths out that beam and provides sort of more of a deep heat energy that pulses a little bit down deeper. And what that does is it brings that heat and stimulates the follicle, the base of the follicle, to grow, to thicken, and then more vascularity will come, which will bring more nutrients, will support that hair follicle in the future. So it's super exciting technology. It doesn't require any downtime. It's relatively tolerable, easy to do sort of in a series over time. If someone's looking for something that is non-invasive, it's a great option. We also often, as you mentioned with combining therapies, we often combine it with injections of PRP. I think we've had absolutely outstanding results doing that. Typically, people are going to be getting maybe a laser therapy every couple of weeks and the PRP every month. We do that for about 3 months. So maybe 6 laser treatments and 3 PRP sessions, and we'll alternate. Going back to the combination therapy, sometimes we'll also do a little bit of very low dose steroid injections because almost all types of hair loss, even the non-traditionally inflammatory ones, do have a little bit of an inflammation process a part of them. And if we can reduce that a little bit, we get much better results in terms of growth and thickening of the hair. It does in some ways. Ultimately, it's pretty similar. Ultimately, we experience the same types of hair loss, the same diagnoses. The pattern is different. The way it looks is different. And also just men and women's hormones and physiology, we oftentimes have to approach it slightly differently in the treatment plans. So for example, a male, let's talk about androgenic alopecia, for example, which is hormonal type of hair loss that affects everyone. Universally, over the lifetime, everyone will get a little bit of androgenic alopecia. Sometimes I joke with my patients, and I say nobody dies in their 90s full head of hair. Everyone thins as we age. Now, some of us thin more and younger than others, and that's a problem for people, and that affects self-confidence. And so that's what we're trying to trigger. But just like we protect our skin, it's important that we do anti-aging things for our hair, because our hair will age with time. And so we can kind of incorporate anti-aging techniques into our hair care process, just like we do for our skin. Now, getting back to your question on the men and women, men will typically have recession of the bitemporal, which is sort of like on the forehead, on the sides, and that will sort of recess over time or scale back. That's one of the areas you'll see some early hair loss. They also have thinning at the crown, the top of the scalp, and that's where you get sort of that circular thinning on the top of the scalp that you'll see if you're sort of looking down at the crown of a male's head. Women with androgenic alopecia, it's kind of the same sort of thing, but it tends to look a little bit different. They'll get widening of the part. So women that have a central part, for example, instead of being a straight line, it might be a little bit wider, maybe, an inch or even wider than that. And then they'll just have sort of diffuse thinning throughout the top of the scalp and a little bit of recession at the frontal. But oftentimes it's just a slightly different picture for men and women on the way it appears. And a lot of times women, there's this understanding that women don't bald the way that men do, and they certainly do. And we certainly need to address that early on so that by the time it becomes really apparent in their maybe 50s, 60s, 70s, we're already sort of proactively managing that and reducing the amount of shedding and that sort of thing later, because it's absolutely devastating for people when I see them and they come in and they're so thin that you can see their scalp everywhere. It's a really tricky thing, and it makes it a lot harder to treat that late in the game.
Definitely. And we'll chat about that here in just a second. And I know that hair loss isn't anything to joke about, but I do kind of jokingly say that as we get older, we gain hair in places that we don't want it and we lose it where we want it. So it is frustrating. It's one of those things that we're always chasing, right?
Yep, absolutely. Yeah, you start to gain hair on the chin for women and other places on the body and lose it up top. Yeah. And that, that type of change over time is really more of the hormonal changes that happen with hair loss. So that's more of the androgenic process and the hormonal processes of aging, basically.
Definitely. Do you find that there's specific treatments that work better for men and others that women benefit more from? Or do you typically utilize the same modalities to treat both men and women?
Well, we use similar modalities, but we do have to be a little bit careful because women obviously can get pregnant, and we have to be really careful to use certain things that could be dangerous in a woman who becomes pregnant, even if they didn't mean to or it was sort of accidental. So some of the hormonal therapies that we use for men, sometimes very early on, I have young men in their 20s or, even late teens that are starting to develop androgenic alopecia and they're really thinning. And so we will start them on something early on to sort of protect their hair. We wouldn't necessarily do that type of treatment for a woman because you never know, things happen. So we do have to be a little careful. Sometimes those hormonal treatments that we do for men, we hold off for women until they're postmenopausal, things like that. But otherwise, we do target hormones. We do target the cellular growth process in both. And so overall, the picture looks somewhat similar, but we choose different things depending on someone's stage of life.
And I think that's so important to point out too, that we do see people that are experiencing hair loss in their 20s. I know one of the things that people say a lot to me is, oh, well, I'm young, I'm not there yet. But they don't realize that there are individuals out there that start experiencing this as early 20s. And it is important to take a proactive approach to it.
Yeah, absolutely. I mean, just in clinic the other day, I saw a 19-year-old, and the week before there was an 18-year-old, and they have a very strong family history of hair loss. Their dads and uncles are both bald by the time they were 30, and they really wanted to do what they could to prevent that if possible. And that's really the way to do it. Once you get to the point where you're totally bald, it is a lot more challenging to sort of make as much progress.
And I think a lot of people really do want to take that proactive approach at home. What are some effective at-home treatments for hair loss that you recommend? And are there any important considerations when combining these with in-clinic treatments?
Again, combination therapy, I think, is almost always the right way to go. So if you come to Zen REGEN, there will always be a home component. There will always be homework, right? You got to do stuff at home to kind of keep up what we've started in clinic and to sort of maintain and build results over time. So home-based treatments would include topical therapies. That might include, topical solutions or foams that are applied either once or twice a day. Let's just talk about Minoxidil, for example. Minoxidil has been around forever, has tons and tons of clinical studies on effectiveness. It also shows, 50% thickening of hair shaft, even some darkening actually has been noted lately, but it works. It's messy, yes, and that's oftentimes a complaint that we get, that it's messy. So sometimes I'll tell people, just use it at night. Use it at night, especially if you're going to shower in the morning. You don't need a lot. You really just need to kind of get it on the scalp itself. And other people kind of have this complaint, well, I don't want to use topical things because I'll have to use them forever. And I see this, I've heard that there's blogs out there that say this, that, if you stop minoxidil or some of these topical things, you're going to get much worse. That's not true at all. What happens is most of the time people forget where they started. So it's important to get good clinical photos, but you improve. The hair shaft improves, the thickness improves, the quality, the density all improve with time. And if you are going to stop that medication in the future, you slowly drift down back to where you would have been otherwise, because the same underlying processes, the hormonal changes, the things that are happening to the base of the follicle are still happening over time. You're just kind of like shutting it off. You're like pushing the valve to make it stop during the time you're treating. Thinking about doing something like this long term or even a lifetime is similar to like putting on lotion or sunscreen for a lifetime, or your skincare that you're using for a lifetime. I mean, it's anti-aging for the hair, it's anti-aging for the scalp. So just, thinking of it that way so it's not so overwhelming and incorporating it to your normal routine, I think is probably the best way to do it. So the topical things I think are great. Supplements can be helpful sometimes. Again, well-formulated supplements, that can be helpful, that are well-researched with good scientific backing and data. Not all supplements are regulated the same. I mean, there's a lot of misinformation out there. So it's really important that you go to a well-known and reputable company. And then there's going to be an oral medication piece a lot of times for a number of people, like prescription medications or something like that. And those obviously will be taken at home. Those things combined together can really, really augment your overall plan with time.
Yeah. And I think consistency really is that most important thing, just like anything in life, right? Consistency and combining these treatments for optimal results and getting the best out of it. Because if you're not hitting it from all sides and you're not doing everything you can, like you said, your homework to really treat the underlying causes and make sure that you're keeping all of that at bay, it is just going to be an issue that you're going to continually deal with.
And right now, medicine is changing so rapidly. Right now, we don't have a lot in almost any part of medicine where we can do something one time and turn off that process, basically cure the underlying condition. We really don't have that ability. Most things in life are sort of chronic. They're going to be waxing and waning, but we can control them. We can manage them. We can sort of lessen the effects with time. And that's kind of what we're doing here, just like with our skincare, is that we are sort of controlling the inflammation, controlling the vascularity, controlling the nutrient supply to the base of the follicle so that it's allowed to grow more properly over time.
Yeah. And speaking of the root causes, one of the things that we hear a lot is that inflammation actually plays such a major role in hair loss. Can you explain how it works and what kind of treatments are best for addressing hair loss that's caused by inflammation?
So I think I mentioned briefly earlier that, there's likely some inflammatory component to every type of hair loss, even the classically non-inflammatory ones like androgenic alopecia. There's likely a little bit of inflammation playing a role there. But classically, the inflammatory types that are a lot of inflammation, there's going to be redness in the scalp, there's going to be sometimes itching, there's going to be tightness. That inflammation is essentially sucking out the follicle, sucking out all the nutrients. It's just completely closing it down so it can't get the supply it needs. And so as that happens, it just sort of withers away. The follicle is not strong enough to stand that over time. It withers away and then it turns into a scar. And once that follicle is replaced by scar, you cannot grow hair through it. You can't even transplant through it. So you really want to prevent that scarring process early on. So again, really important reason why you need to know exactly the type of hair loss you're dealing with when you approach it from the beginning, because the worst thing in the world is to start treating something and then to realize a couple years later, you had the wrong diagnosis and you didn't quite do it the way it really needed to be done.
So are these some of the symptoms that you look for when you're diagnosing somebody with, say, alopecia areata?
Yeah, absolutely. So almost every evaluation is going to ask, a lot of times hair loss is asymptomatic. They're just shedding, they're losing hair. And that's typically the non-inflammatory types. But we will ask, are you having any itching? Are you having any burning? Is there any tightness? Is there any scaling? Because sometimes there's some what's called seborrheic dermatitis, which is a little bit of a scalp rash that can contribute and it cause some inflammation that leads to hair loss. So we want to make sure that we're addressing those symptoms, because those symptoms are essentially an underlying sign of what's happening under the skin. So it's sort of like a canary in a coal mine. If someone's having itching or tightness or irritation, we know there's inflammation happening. We also can see that typically on exam. We can see that there's maybe redness or erythema on the scalp. Sometimes it's specifically wrapped around the follicle. So that's called perifollicular erythema, where the base of the follicle clinically appears red. And we do need to address that because that's a specific type of scarring hair loss that can happen. That's part of the evaluation. And that's part of how we tailor the treatment process.
Last week on my episode with Dr. Ruby, we talked a lot about lifestyle interventions to help reduce the inflammation process in the body. Do you use steroids if it's, significantly deeper issue that will actually help reduce the systemic inflammation, or what are some of your go-tos?
Not often do we do systemic steroids. We sometimes do, and that's usually in very severe, very rapidly evolving inflammatory types of hair loss. Most of the time, we do what's called intralesional injections of a very low dose of a steroid. And what that is they're essentially little teensy-beensy micro-aliquots, micro injections throughout the scalp. And what that does is it delivers this very safe, very low dose steroid to the base of the follicle where all that inflammation is like wreaking havoc on the follicle, and it just shuts it down immediately, completely shuts it down. So it's, in my opinion, I know a lot of people are nervous about steroids. It is local. It does not become systemic at the dose that's used for this purpose. It's very low dose. And basically what we're doing is we're just trying to shut down that inflammatory process so that the hair is allowed to grow. It really cannot grow well with all that inflammation. So intralesional, or sometimes we call IL steroids, and we oftentimes use Kenalog, which is a type of steroid that's frequently used for hair loss injections. And we do them sort of in a grid pattern where you're losing the hair. And that can be game changing. Absolutely. It can absolutely shut down that inflammation and those symptoms, and is oftentimes a very necessary component to a well-balanced treatment plan.
And another underlying condition that we were talking about is hormones. And we hear a lot about DHT being another major culprit in hair loss. Can you break it down for us? Just explain to our listeners what DHT is and how it can affect the hair follicles.
DHT is a testosterone breakdown, dihydrotestosterone. This particular molecule likes to sort of go in and squeeze out the nutrients at the base of the follicle. It kind of reduces the blood flow. It sort of squeezes down the size, the diameter of the base of the follicle. So it's not allowed to get the nutritional value it needs to essentially survive. And this can happen for both men and women. Even though this is a testosterone byproduct or end product, women experience this too. And that is oftentimes why women are experiencing hair loss. So what we do for that is do things to sort of shift or alter that testosterone breakdown pathway away from the DHT arm. Because a lot of times when you have a hormone or any molecule in the skin, as it breaks down, as it goes through its chain throughout your body, there's different ways it can go. It can go to the right, it can go to the middle, it can go to the left. And depending on which way it's broken down, it has different end effects on the body. And there's sometimes byproducts or end products of various hormones or other things that are healthier or safer or just better for you than others. And for whatever reason, some of us experience a higher level of the DHT sort of shunting pathway. And those are the people typically with the androgenic alopecia that is more severe and happens at a younger age. And so a lot of our treatments for that androgenic alopecia target blocking that pathway in one way or another, or redirecting that breakdown to another less harmful pathway.
That makes sense. And when it comes to managing DHT related hair loss, I know finasteride is one of those go-to treatments. Can you break that down for us and tell us how it actually works?
Yeah, so finasteride is a 5-alpha reductase inhibitor. It's in a class with another medication called dutasteride, which is also sometimes used for hair loss. Dutasteride is a little bit more potent. And so someone that has tried finasteride and failed or is just looking for a little bit more will sometimes be switched to dutasteride. But essentially what these do is they're DHT blockers. So just like we said just a few moments ago, they're able to sort of block that end pathway to DHT, which allows sort of more blood flow to the base of the follicle and allows it to grow.
I know finasteride is a really effective treatment for a lot of people, but one of the things that I hear a lot, of course, from men is they worry about the side effects of erectile dysfunction. That's something that is talked about all the time. And I imagine that's a huge concern, especially if someone's already struggling with confidence issues and with thinning hair. How do you approach that conversations with your patients?
With anything and any treatment we ever offer, you should be aware of the risks and benefits and potential side effects. Absolutely. That is out there. That is certainly something that's published, that's online. There have been some legal cases about it, which is why it got really big. I will tell you, it's a very, very, very rare occurrence. In 15 years of practicing, I've never had a case, knock on wood. I don't even have a colleague that's had a case. So it's super duper rare. But that being said, yes, it's concerning. And there are a few patients that after hearing that risk benefit discussion, they're like, I don't want to do that. But it's also important to address that erectile dysfunction. If that's if it's already occurring and they're already experiencing confidence issues, it's important to address that too. And what a great way to sort of open the door and say, hey, listen, we also have things that can help you with that. At Zen REGEN, we actually have a whole sexual wellness arm of our clinic. We have various treatment options for erectile dysfunction, from topical things to oral things to ultrasound-based devices that really, really help minimize that. So yes, overall, all of these things affect self-confidence. They all affect how we feel about ourselves and should be addressed, as part of the discussion of the risk benefits, as well as separately if that's a concern for the patient.
That's so important. And I think that truly does set us apart at Zen REGEN. And I am such a firm believer that if you look good, you feel good. If you feel good, you perform better. And who wouldn't want to look and feel their best so that they can perform even better in bed? But I mean, in all honesty, that's an entirely different topic that we can talk about for a really long time. And we certainly will address that in a later episode. But I know that a lot of people worry about whether they've waited too long to actually start treatment. So how can somebody know if it's too late to begin? I know you had talked about the scarring portion of things and you don't want to wait too long. How do people know when they need to begin and if they're going to get benefit out of treatment if they've hit that certain advanced stages of hair loss?
I think it starts with an evaluation, right? We have to have an evaluation that looks at the picture, that asks the patients the questions, that clinically looks at the scalp. I mean, that's really the only way that it can be done properly, is that someone has a consultation. Someone that knows what they're doing looks at them, make sure that we have the right diagnosis, and we can kind of see where we are in that process. I will tell you, almost always, it's not too late. Almost always. There are cases that, unfortunately, sometimes that does happen if someone's entire scalp turns to scar. So we do want to address things early in the process. So someone's having, a lot of itching, a lot of scaling. That doesn't mean it's going to lead to hair loss, but we can certainly look at that. If someone's going through traumatic life events, if someone has surgery that just finished chemotherapy, that has a lot of things that might expect a huge stress response in their body, they're going to have probably a cycle of hair loss called telogen effluvium about 3 months later that might last, anywhere from 3 to 12 months. And when someone has that on top of an already mild level of androgenic alopecia or the hormonal alopecia, it's sort of like off the charts, So all of a sudden they'll be like, I'm losing so much hair because maybe they had a little bit of hair loss starting, a little bit of androgenic alopecia, but now they have this thing called telogen effluvium and they're just rapidly shedding and they're bringing in baggies of hair. That's where we want to get it. If you know you're having a big thing or a big stress in your life, it's helpful to start taking care of your scalp. Because I tell people, when you have a lot of stress in your life, whether it's mental stress or physical stress or just stuff going on, moving, even weddings, which are great, can be very stressful, divorces, all these sort of things can put a lot of taxes. During that time, your body sort of focuses on what's important to keep you alive, right? It's not so much worried about your hair, your skin, or your nails. It's like the least of its worries. So it's working on getting blood flow to your brain, your heart, your kidneys, that sort of thing. And so without that nutrition, without that blood flow to those areas, they don't get what they need to properly grow. So a lot of times they sort of shut down, they slow down. You're going to have, changes in your nails. Typically, you're going to have changes in your hair. You're going to have shedding, but that process often takes a couple of months. So people will say, I had this thing happen a while ago, and then 3 months later, they just start to shed, and that continues. So that's usually when we want to intervene if possible. But I think it's always important to just come get evaluated, because most of the time we can make a difference. Most of the time we can do things that help grow the hair for sure.
So if somebody's going to be going through one of those prolonged stressors in life, what are some things that they should be doing to give their scalp a little TLC?
It's hard because when you're going through those prolonged stressors, it's sometimes hard to think about yourself or, these self-care things. Maybe you're taking care of a sick relative or something like that. I tell people, number one, cut yourself some slack. You are doing a lot. If they are doing all they can with what they're doing in their life, maybe that's all they can do. But if they can do a little bit more, start small. Even just 30 seconds, 2 or 3 times a day of deep breathing will help reduce that stress response. Because this stress response can either be an acute situation where it spikes for, like you had a surgery or you were in a big accident or something like that, a car accident. That's a single event that you'll 3 months later start to shed. Or someone could have just lots of little stressful things. Maybe you have a sick child or a sick parent or, a number of things, or a bad relationship, and that's sort of an accumulative thing. And you'll have this sort of shedding for a longer period of time because it's not a single spike in stress. But doing things that can kind of reduce that stress hormone response a little bit, deep breathing, even if it's just like 30 times a day with breakfast, lunch, and dinner, will make a difference. Exercise is huge, absolutely important for your overall health and, your stress hormones and to help lift your mood essentially. So doing that ideally 30 minutes, maybe 3 to 5 times a week would be great. A little bit of gentle massage. It sounds silly, but maybe when you're in the shower washing your hair or when you're just watching TV, that can be with a scalp massager, that can be with your fingers. Sometimes they actually have these massagers now that have LED red light part of them. And they also, while you're doing it, release a small amount of serum. So if you have a great hair growth serum like the G-Bone one, you can get these scalp massagers that have red light with them, which can help a little bit with vascularity and blood flow. And they have a little bit of the serum and you could just sit and massage it while you're waiting. So those are some things you can do at home. There's some evidence potentially that microneedling very, very superficially might be helpful. Home microneedling devices, which are just little rollers, what they do is they just very, very gently sort of pierce the epidermis and allow things to sort of transfer better across the skin barrier. Some people are doing this with topical hair growth solutions. You do want to caution people that they sell various lengths online and they're not terribly well regulated, it appears. So you want to be careful not to get anything that's too deep. I think, honestly, 0.2 or less is just fine. Just a tiny little bit piercing to allow things to penetrate. The other caution on that I'd want to make is that not everything is meant to go deep down. And so you have to be careful of what you're putting on the scalp and that it's going to be higher potency of what you would have put on not doing that. So those are little caveats there. But those are some of the things you can do at home. LED red light, I think, it's got promise. There's some evidence that it could be helpful. They're not terribly well regulated because it's an over-the-counter type of product, but I think it's reasonable and it's low risk, and I think that it's easy to do. They make LED red light caps and helmets and things like that, and that's something you could do that would be pretty straightforward. Taking a supplement, a well-developed supplement could be helpful too. So those are things that I think you could do at home. If you know that there's something coming up that wouldn't take a lot of time, that wouldn't sort of add stress to your life, that would be very, very helpful. And then we have other patients that they sort of proactively know, and they'll come in and they'll say, I'm going to have PRP injections, or I'm going to do the Fotona laser X restart a couple of times because I got this stuff going on and I know it works. I've done it before and I want to do it maybe 3 months after this is happening, after I have surgery. And that just sort of prevents, that loss from happening.
Self-care is such an important part of life that I feel like many of us, we're always the last to take care of ourselves. I know for me, when you get busy, it's really hard. One of the things that I do is I will actually set reminders on my phone to remind myself to take a break, to do some deep breathing. And I'm sure you are even busier than me with 4 kids. What are some practical tips that you use in your daily life to remind yourself to focus on yourself for even if it's just a few minutes out of the day?
You're absolutely right. 4 kids, multiple businesses, lots of things going on. I actually have to schedule it in like it's a meeting. So I will put it in Google Calendar, or, I'm a list person. I like lists. I like written lists. I like digital lists. So we'll have lists to do. I have even a calendar that I carry. But I think it is really important to sort of intentionally, there has to be intentionality about that, intentionally plan it into your day. Once you start to do something over and over again, I think somewhere between 14 and 21 times, 21 days in a row, it becomes more of a habit, right? In the beginning, it's very easy to do things once or twice. And that I think happens with a lot of us. That's why the gyms are always so packed right after New Year's. Everybody's sort of like, yep, I'm going to get healthy. And then by February, they're empty again, right? For the most part. So once you've sort of committed to like that 21-day cycle, it's going to be much easier for your body. It expects to do whatever whatever it is you've set out to do. So whether that's waking up in the morning and just starting with 30 seconds of deep breathing, whether that's, going for a run as soon as you wake up in the morning, whether that's having your supplements that you're going to take right by your toothbrush, because most of us don't forget to brush our teeth, things that are intentionally done so that it becomes just part of your routine. It's not difficult, because it's really hard when we're busy to add more things, right? Adding things that are built into the schedule that just become part of, kind of the way you do things, part of your work day, part of your just normal life.
Thank you for sharing. And I love that tip about putting your supplements by your toothbrush. I do the same thing. Or I keep them in my cabinet where my protein shakes are so that I remember to take them. I also feel like this day and age, everybody's so focused on that quick fix. So when it comes to hair loss, I feel like a lot of people instantly go to hair transplant. I think that there is definitely a place for that for a lot of people. And I know that at Zen REGEN, we focus a lot on non-surgical treatments. So when do you recommend your patients, or how do you help guide them through that process on which direction to go, surgical versus non-surgical?
As always, when we do a consultation, I think it's really important to outline all of the options for a patient. We are never one to omit things that we don't do. So let's just say hair transplant, for example, since we're talking about hair, is a valid treatment option for hair loss, right? We wouldn't not discuss that in someone's initial visit just because we don't do it. So I think it has to be part of that initial discussion. I think that certainly it's kind of a bigger deal. It's very, very expensive. The newer versions, I know some people are flying to Turkey for these things, and various places. Hair transplants previously were, a little bit more barbaric. They would sort of cut this large area from the back of your scalp and you'd have a big scar there, and then they'd sort of transplant. Now there are some robotic options, which are very, very cool, and they can be effective. But I will tell you, I know a couple of hair transplant surgeons, and they're still going to want you to do all the things we do. Even though you got a hair transplant, you still have that underlying process going on that caused you to lose hair in the first place. So they don't want to transplant your hair and then a few years later have you lose it again, because you're still having, that hormonal changes, you're still having those sort of normal aging changes. So most of the time, people with hair transplants will still be on some of these topical and oral things. They'll still maybe get PRP. They'll still maybe do some laser therapy. So it's not mutually exclusive. I would say most of the time, most of our patients aren't ready for a surgical option. And so I think that's where we started. But if someone is quite advanced and they are ready, I think it's a great option. And we always want to sort of keep that on the table for people.
And I think that's so important. One of the things I was actually just talking to one of my friends about the other day was the difference between surgery versus non-surgery. And we were talking about risk versus reward and cost versus benefit, right? I think when you break it down like that, it puts things a little bit more into perspective. And one of the misconceptions that this friend of mine had was that if they just do a hair transplant, it's a end all be all. Like they never have to do anything after that. And I was explaining that that's not the case. Exactly what you just said, that yes, your natural remedies are still just as important. You still have to combine those treatments and utilize your topicals and those orals and still do your homework, and then also protect your investment. After you have a hair transplant, you're going to continue to lose your hair over time because we're not stopping the aging process. We're not addressing any of those underlying causes. And so you have to combine all of them. And I think, Dr. Chambers, that's something that you and I are both on the same page when it comes to the natural remedies for hair loss. I know that there are individuals out there that are completely against these cosmetic services or even a surgical option. And I feel like natural remedies definitely have their place, but I feel like people sometimes expect them to be the magic bullet, or the opposite, where the surgical aspects of things is going to be that magic bullet for them. I think it's just really important for patients to know that you have to look at this from a holistic perspective and really approach it from all areas.
Absolutely. I think there's a place for all of it, right? I think board certified dermatologist, I was trained in sort of classic Western medicine, pharmaceutical type things. I also did a fellowship in integrative medicine. And so I can really appreciate sort of the more integrative or holistic treatment options. And you have providers out there and you have patients out there that are just all in one way or the other. And all they want to do is just think that's the only way. And then there's sort of like this conception that the other side is bad, or, it's sort of like one versus the other. I really feel like your best outcome is going to be when you merge those and you come up with something even better. I'm not opposed to any of it. I think it all has a place. And, sometimes it's patient specific. What are they looking for? What outcome are they looking for? I think whatever we decide upon, I think we just have to sort of explain what are the expectations? What's realistic with this particular treatment plan? You're not going to get a hair transplant result from taking one supplement a day or something like that. It's not realistic. So you have to sort of paint the picture. You look at what's expected, what's realistic, what are the side effects, what are the benefits. Obviously, costs for a lot of people is going to play a role in that too. And then we sort of decide what makes the most sense for you right now in your life at this stage of your hair loss.
Wonderful insight there. One of the things too, Dr. Chambers, I know research is so big for you and such a big part of your life. Can you share any research insights on emerging treatments or products that are in the field of dermatology that are effective for hair and scalp health?
Yeah, so we do a lot of clinical trials. We do things that are pharmaceutical, so medications that eventually will go to market and be prescription. We do things that are more nutraceutical, things intended to be over the counter like supplements or topical solutions, things like that, but also need to be rigorously studied so that maybe a group or a company can make a claim that it actually does something. A lot of people will say things work, but unless there's actually well done data, you have to be a little skeptical. I think it's really important these days to be skeptical about everything you read. Where is this information coming from? What's the data behind it? Who published it? Who paid for that study? That sort of thing. So yes, we do a lot of clinical research. There are new topical things emerging on the market. There's new combinations of maybe supplements that have been around for hundreds of years that are being now put together to have a synergistic effect. I know in Givome, we just formulated a topical product that now is undergoing clinical trial. So I'm very excited to see, can't be a part of that study because I was part of the formulation process, but I'm excited to see what happens with that. And hopefully, each individual ingredient has been studied on its own to be very effective for hair growth. And we're hoping that by putting them together, we get an even better synergistic effect.
And I think that's something that a lot of companies get wrong, is they're not doing clinical trials on their completed product. So it's not a regulated industry. People can literally put whatever they want into these supplements, and there's not necessarily any data to prove that it is effective. So I also am very excited to see what the data shows on our products for sure. What about things like exosome therapy or peptides?
I think this is a super exciting area of medicine. Also, I tend to be a nervous person, and I'm a little nervous because it's not terribly well approved by the FDA yet. And, there's a lot of things out there that is not yet well regulated. And so I think in this sort of area, I think it's very exciting, but I do feel like we need to slightly proceed with caution until we have some better data, because I think a lot of the things that are being pushed right now, are being pushed sort of through back channels that are not yet well studied. People are claiming that they're doing all these remarkable things, which maybe they are, that would be great, but we'd like to see some data to show that, right? I think as a board certified dermatologist, I think my colleagues would agree, unless you have a well done trial, unless you have some data to show me, I don't believe you. So I think very excited. I do think that they are going to offer a lot of new therapies in the coming years. I think peptides, specifically, protein chains that kind of direct the cellular process, super exciting. Even some of the big weight loss drugs right now are peptide based, so there's really cool things, but obviously those were well studied and they're now well regulated. And so, that's a different thing than if you're having peptides going straight to the market that really haven't been studied very well. So I think, again, a big reason why I like to be involved in clinical research, I think it's important to advance the field. Otherwise, everybody's just sort of making it up, and people can do and say whatever they want. So I think TBD on that one.
Yeah, I'm curious to see what the long-term effects have. I also am very excited about these up-and-coming treatments, but I'm with you on that. Well, Dr. Chambers, we've talked about so many different aspects of hair restoration today, from non-surgical to surgical, more advanced options. And again, this can be such an overwhelming process for people. So for our listeners who might be feeling very overwhelmed by all of this information, what are the first steps that they should be taking to address their hair loss? And how do you help guide them to find the right treatment plan that fits their unique needs?
I think the first step has to be a comprehensive evaluation. I think that absolutely has to be done because I think, again, we mentioned earlier, it's really important to know what's going on. What diagnosis are we looking to treat? And then what other things are factoring into their hair loss? Is there any events that have happened or things that are, sort of leading to the process? So the evaluation is crucial. And then from there, we decide what of the different options do we have makes sense for you? What should work? And then what do you feel open to? I have patients that they really want to do just one thing at a time. They're cautious. They want to take things slow. But I tell those people, awesome, no problem. We can take it slow. But remember, whatever we do, you're not going to see almost anything for 6 months. It is a slow process. And then in 6 months, it's not going to be a lot. It's really more like 12, So 6 months is just our check-in where we say like, hey, are we still going in the wrong direction, or are we at least kind of slightly going in the right direction? If you think about it, that's a very long time. That's a long time for people to do something and not 100% feel like things are totally magically better. You have to set that expectation from the beginning. That 6 months is a check-in. We're looking for little baby hairs. We're looking for less scalp show. We're looking that things have not worsened from the beginning. And then really it's that 12-month period where people are like, oh, okay, I see. But again, another reason why you have to go to someone that knows what they're doing, because we will take photos and we will show you. Even at that 6 months, when I just had a patient yesterday that was like, I don't really know if it's working. And we pulled up her photos and we put them side by side. You could see it was working. It's improving. It's a slow process, but it's improving. But then I have other patients that are like, I'm freaking out. Let's do all the things. And so we'll put together a plan that includes all the things. It will be a topical treatment. It will be one or more oral therapies. It will be maybe PRP injections, maybe even low-dose Kenalog injections, the laser treatment. That approach where you hit everything is going to give you the best results no matter what. That's going to give you the best results. But not everybody's open to that. And so what we like to do is feel out where people are at. They may want to do 50% of that or 80% of that. But if someone's all in, I think if we do sort of hit all those pathways, it's going to ensure the best results over that 6 to 12 month time period.
And I love that you're setting that realistic expectation of 6 to 12 months. It's not 3 to 4 weeks, because I hear that a lot where people are like, well, I've been doing this for 3 to 4 weeks and I'm not seeing any change, so I'm just going to stop my treatment. It doesn't work that way. So I appreciate that you are just making that point that you have to be consistent and you won't see big changes for 6 to 12 months. It is a process.
Yeah. And I tell people, as long as you feel comfortable that the people that are treating you, the provider, the person's treating you knows what they're doing, trust the process. If we have these things in place, these are the most well-studied, the most sort of well-documented therapies that are available. And so if we do all the things that I just mentioned a moment ago, there are no other things, other than maybe, a hair transplant, if that's where they want to go. But that covers all of our bases. You just have to trust that it's going to get you there. But you have to be patient.
Dr. Chambers, thank you so much for sharing your expertise with us today. If you guys have more questions about hair loss treatments and you're ready to take another look at things, definitely check out zendermatology.com, where you can schedule a comprehensive consultation with Dr. Chambers. Can you tell people how to find you if they're interested in learning more about hair loss treatments? Where would they go to find you?
Yeah, you can find me at Zen Dermatology or Zen REGEN, and I'm open to do comprehensive consultations, and we'll talk about it.
Perfect. If you're ready to go a little bit deeper, don't forget to subscribe to my YouTube channel to watch today's episode and follow me on Apple and Spotify so you never miss one. If you're looking to book an appointment with Dr. Chambers, we've got the booking link in the show notes, along with a link to G-Vome's hair and nail support supplement, our pro collagen, and other information about Zen REGEN for those of you wanting to give your hair health an extra boost from the inside out. Stay tuned for next week where we'll jump into more exciting information. Enjoy your day, and I'll catch you next week.